I was a trauma surgeon for more than 2 decades, and I have seen nearly every way the human body can break. Gunshot wounds that tore through ribs like paper. Car accidents that left twisted steel and mangled flesh fused together. Overdoses where we fought for hours against a flood of chemicals that no heart should survive. I've held the hands of parents as their children slipped away, and I've walked out of operating rooms drenched in sweat and blood, only to scrub up and step back in for the next case. That's the life of a surgeon in the emergency room, relentless, unforgiving, and always just one phone call away from a nightmare. But even after all those years, there was one case that didn't just test my skills. It broke something inside me that I still haven't been able to mend. The night it happened, the emergency room smelled like it always did. Bleach and iodine trying to mask the iron tang of blood and the sour stench of fear. The overhead fluorescence hummed, flickering in that way that makes every shadow look too long, too alive. Machines beeped in a syncopated rhythm. Ventilators sighed, monitors chirped, and beneath it all was the steady, constant murmur of voices. Nurses calling for supplies, paramedics relaying vitals, families crying or praying just outside the trauma bays. It's a soundscape you learn to live inside, like a second heartbeat. You can't tune it out, but you stop noticing it until something changes. That night, something changed. It was past midnight, the hour when exhaustion sets in and you start to feel like you're moving through water. I was finishing paperwork in the small glass-walled office that overlooked the trauma bays. My shoulders ached, my eyes burned, and I was trying not to think about the 6-hour operation we just pulled off. A young man with a knife wound so deep it nearly split his liver. He lived. Most don't. I should have felt relief, maybe even pride. Instead, I felt that hollow emptiness that creeps in after a big save. The awareness that for every life you pull back from the brink, another is already lining up outside the ambulance bay, waiting to test you again. That's when the radio crackled. The voice of dispatch came through, strained but professional. Incoming trauma, ETA 5 minutes. Male, mid-30s, found unresponsive at home. Initial rhythm P, EA, intubated. Spontaneous pulse regained. Vitals unstable. Pulseless electrical activity. A heart showing signs of life on the monitor, but not actually pumping blood. The fact they'd gotten him back at all was something of a miracle. But miracles in my world are fragile, slippery things. They never last. I stood, rolling the ache out of my neck, and stepped out into the bay. The team was already moving, nurses laying out crash carts, respiratory therapists priming ventilators, an anesthesiologist pulling on gloves. I didn't know yet that this was the case that would follow me into my dreams, the case that would make me question everything I thought I knew about surgery, about medicine, about life itself. The double doors slammed open as the paramedics rushed in, the gurney wheels rattling against the linoleum. The patient was tall, gaunt with skin the color of wax. Tubes protruded from his mouth. His chest rose mechanically with the rhythm of the bag valve mask. His eyes were half open, but rolled back, showing only whites. He looked less like a man than a marionette whose strings were being pulled by unseen hands. The lead paramedic shouted, "Found him down at home. Unknown downtime." Wife says he collapsed in the kitchen. CPR started on scene. Intubated, epinephrine, X3, regained pulse after 25 minutes. Still bradycardic, still unstable. 25 minutes. My stomach sank. The brain doesn't tolerate more than 4 or 5 minutes without oxygen before permanent damage sets in. Anything beyond that, even if you bring the body back, the person is gone. But sometimes, rarely you get lucky. I've seen patients wake up, confused but alive, after half an hour under. So we worked. We always work. We transferred him to the trauma bed, lines already running wide open, monitors springing to life. Numbers flashed across the screen. Blood pressure, 70/40, heart rate in the 30s, oxygen saturation, barely clinging at 82. His chest was bare, ribs jutting like branches. No obvious wounds, no blood. Just a body that seemed to be collapsing in on itself. I barked orders almost by instinct. Push atropine. Start dopamine. Prep for external pacing if we need it. The team moved in practiced choreography. It's something most people never see. The way a room full of strangers can move like one organism when a life is slipping away. I leaned over the man, listening to the faint, wet rasp of air moving in and out of his lungs. His skin was cold, too cold for someone pulled from a warm kitchen floor. I pressed my hand against his neck, feeling for a pulse. It fluttered beneath my fingers, weak and irregular, like the beating of a moth against glass. I looked at his face then, really looked, and something in me froze. His expression wasn't slack the way most unconscious patients look. There was tension there, tiny furrows around his mouth, a slight twitch in his eyelids, almost as if he were straining, as if he knew something the rest of us didn't. I shook it off. Stress hallucination, nothing more. The body makes faces. Nerves fire at random. The wife arrived minutes later, escorted in by security. She was young, too young, her hair still damp from the shower she must have rushed out of when the ambulance took her husband. She clutched a bathrobe tight around her, eyes wide with disbelief. He just collapsed, she whispered. He was fine. And then he just fell. He wasn't breathing. I didn't know what to do. Her voice broke on the last word. I wanted to comfort her, to promise we'd fix him, but the truth is, I didn't know if we could. Instead, I gave her the line we all learn early in our careers. We're doing everything possible, and we were. But even then, I felt something gnawing at the back of my mind. Something about him didn't make sense. We pushed medications, warmed fluids, adjusted ventilator settings. His blood pressure climbed briefly, then crashed again. Every lab result that came back was normal. No electrolytes out of range, no signs of toxins, no cardiac markers elevated. It was as if his body had simply decided to quit, without warning, without reason. That's not supposed to happen. There's always a reason. Even if you can't fix it, you can usually find it. I leaned closer, studying the rise and fall of his chest, the rhythm of the monitor, the lines tracing across the screen like a seismograph. I've done this long enough to feel when a patient is slipping through my hands even before the numbers tell me. And I felt it then, the inexorable slide toward something I couldn't stop. Around us, the ER churned on. A drunken bed, 3 screaming for water, a child crying in bed 5. A code called overhead for another patient down the hall. But inside our bay, the world had narrowed to this one man, this one failing body. The fluorescent lights buzzed overhead, harsh and unblinking. Sweat dripped down my back beneath my scrubs. I adjusted my gloves, staring at the man's pale face, and for the briefest moment, I thought his lips moved. Just a flicker, like the shape of a word trying to form. But there was no sound, no air. I told myself it was nothing. Muscles twitch. Nerves misfire. That's all. Still, I couldn't shake the feeling that he was trying to tell me something. Something urgent. Something I wasn't hearing. I've carried a scalpel into operating rooms more times than I can count. I've cut into flesh, into bone, into the chambers of a heart itself. I've learned to read the language of blood and tissue, to hear what a body is saying even when the patient cannot. But that night, as I looked down at him, I realized I couldn't understand this language. His body wasn't following the rules. It wasn't telling me what was wrong. And without that, I was blind. When you've spent years in trauma surgery, you learn to live in the space between science and chaos. You trust the textbooks, the algorithms, the data, but you also trust your instincts. The quiet sense that tells you when to cut deeper, when to stop, when to gamble a life on a single stitch. My instincts were screaming that something about this case was wrong, fundamentally wrong, and yet I had no evidence, no explanation, nothing I could point to and say, here's the reason. So I did the only thing I could. I prepared for surgery. We rushed him upstairs, the gurney rattling along the tile floors, fluorescent lights flashing overhead in quick strobe as we passed beneath them. The smell of antiseptic thickened, mingling with the copper tang of blood left from earlier cases. My heart pounded not with adrenaline, but with dread. I didn't know what I would find when I cut him open. I only knew I had to try. As we wheeled him down the corridor toward the operating suite, I caught sight of his wife again. She was running to keep up, barefoot on the cold tile, the bathrobe flaring open with each hurried step. Security tried to hold her back, but I lifted a hand and told them to let her walk beside us. Something in her eyes told me she needed to be close, even if she couldn't cross the sterile line. She clutched the railing of the gurney as we moved, her knuckles white, her lips moving in what might have been prayer, or what might have been denial. I've seen families in every shade of grief, from the screaming and cursing to the stunned silence that makes them look like mannequins. But this woman wasn't breaking down. She wasn't quiet either. She was alert, almost hyper-aware, as though her body refused to process what her mind already knew. At one point she whispered, "He told me. He said something like this would happen." I stopped in my tracks just for a second. "What did he say?" She looked up at me, eyes wide and shining. "2 nights ago, he said he felt off. He said he dreamed his heart stopped, and he couldn't wake up. I told him it was just a nightmare." I wanted to tell her that nightmares don't kill people, but I've been in this field long enough to know there are dreams that gnaw at the body until they become prophecy. I nodded once, not trusting myself to speak, and kept pushing the gurney forward. Inside the prep area, we transferred him to the OR table. The scrub nurses moved quickly, attaching fresh lines, swapping out leads, drawing new labs. The anesthesiologist checked the ventilator, muttering under his breath about settings and oxygen flow. His wife stood just outside the glass, arms wrapped around her body like she was holding herself together. I caught her reflection in the window as I scrubbed in, and for the briefest moment, I thought I saw her husband's face reflected beside hers, his lips forming the same half-word I'd seen earlier in the ER bay. When I turned back, he was still on the table, motionless. Just a trick of the light, I told myself. Fatigue, stress. The ritual of scrubbing in is something most people never think about, but for a surgeon, it's sacred. The hot water scalds your hands, the soap burns in the cracks of your skin, and you stand there with your arms raised so nothing contaminates them as the nurse slides the sterile gown onto your shoulders. It's supposed to make you feel clean, prepared, in control. But that night, the water felt too cold. My hands trembled, not from exhaustion, but from a dread I couldn't explain. As I stepped into the OR, the world shrank to that familiar, sterile cube of light and shadow. Bright overhead beams pooled onto the body on the table, while the corners of the room disappeared into dimness. The air smelled of betadine and plastic, antiseptic and sweat. Monitors flickered with numbers that looked stable one moment and catastrophic the next, a cruel pendulum swinging between life and death. Every sound was magnified. The hiss of the ventilator, the steady beep of the EKG, the metallic click of instruments being arranged on the tray. I glanced at his wife again through the glass. She was crying now, silent tears tracking down her cheeks, though her expression hadn't broken. She looked less like a grieving widow-to-be than a witness at some trial she didn't want to attend but couldn't look away from. I wanted to believe she was watching me, trusting me to save him. but it felt more like she was watching something beyond me, waiting for the verdict she already knew. I looked down at him, at the stillness of his chest, the fragile line of his collarbone, the slight tremor in his eyelids that still hadn't stopped. 25 minutes without a pulse. No trauma. No toxins. No clot. No bleed. Everything normal, except the fact that he was dying. I thought of the textbooks, the neat categories of causes and treatments, the flow charts we memorize in medical school. None of them covered this. None of them prepared me for a body that had simply quit without reason. And in that moment, I thought of other cases that had haunted me but never broken me. The young boy crushed under a tractor who survived 2 hours of surgery only to slip away when his mother kissed his forehead. The teenager with leukemia whose heart gave out just as we were prepping for transplant. The middle-aged man who came in laughing, joking about chest pain, and was gone 5 minutes later on the floor of the waiting room. Each one had a cause. Each one had a box I could put it in, however cruel. But this man had no box, and I felt the walls of my own certainty closing in. The anesthesiologist looked up at me. "He's dropping again," he said flatly. I glanced at the monitors, blood pressure plunging, oxygen desaturating, the line of his pulse fluttering like a candle flame about to gutter out. My heart slammed against my ribs. This was it. If I didn't act now, there would be nothing left to act upon. I reached for the scalpel, and just before the steel touched skin, I glanced at his face one last time. His lips moved again, this time more clearly, undeniably. A shape, silent but distinct. It looked like the word *stop period. I froze, scalpel hovering inches from his chest. The room seemed to contract. The air sucked out as every sound dulled, every movement slowed. I could feel the eyes of the entire team on me, waiting. My own breath sounded too loud, ragged against the muffled beeps of the machines. Outside the glass, his wife pressed her hand to the window, her mouth moving in a soundless whisper I couldn't hear but somehow knew was the same word. "Stop!" For a moment, I thought about putting the scalpel down, walking away, letting the body decide its own fate. But that's not what surgeons do. That's not what I had built my life on. We fight. We cut. We stitch. We refuse to stop, even when everything in us screams that we should. My knuckles whitened around the handle of the scalpel. I closed my eyes just for a second, steadying myself against the pull of something I couldn't explain. When I opened them again, the word was gone from his lips. His face was slack once more. "Scalpel," I said. The nurse pressed it into my palm. The overhead lights seemed to blaze hotter, brighter, as though the room itself knew we were crossing some line that couldn't be uncrossed. I drew in a breath, raised the blade, and pressed the first cut into his skin. The scalpel split the skin with the clean inevitability of habit, the blade gliding through flesh that parted almost too easily. I'd made this incision countless times before, upper midline, swift and direct, the fastest path to the heart and major vessels. But this time, something felt wrong the moment the blade touched. The tissue wasn't just yielding, it was collapsing, as if it wanted to be cut, as if it had been waiting for it. The nurse handed me retractors, and I spread the incision, watching as layers gave way one by one. Muscle slackened without resistance, as though it had no strength left to hold itself together. I expected to find blood pooling, signs of rupture, a tear, a clot. Instead, the cavity was disturbingly clean. Too clean. No swelling, no seepage. Just a stillness that didn't belong in a living body. "Vitals are dropping," the anesthesiologist warned. The monitor screamed a low, erratic line, each beep separated by a gulf of silence. "Open wider," I ordered, my voice harsher than I intended. The team obeyed, metal gleaming under the lights as they pulled the wound apart. The man's chest cavity spread before me, organs pale and shimmering under the glare. And that was when my hand hesitated. The heart. I'd seen hundreds, maybe thousands of hearts. Beating, ruptured, still. But I had never seen one like this. It was moving, yes, but not in the way a heart should. It didn't contract and expand in rhythm. It writhed, twisted, as though something beneath its surface was shifting, searching. Each beat was irregular, arrhythmic, yet somehow strong enough to keep him teetering on the edge of life. I leaned closer, my gloved hand hovering above it. I could swear I felt heat radiating off the muscle, a searing warmth that prickled through the latex and into my skin. Hearts aren't supposed to radiate heat. They're supposed to pump. This one looked like it was trying to escape. "Doctor?" The scrub nurse's voice trembled. "What? What is that?" I realized too late that everyone was staring, the entire team transfixed by the grotesque rhythm of the organ before us. I should have broken the spell, barked orders, done something to reassert control. But for one long second, I just stood there, frozen, listening to the monitor stutter its warning tones. Finally, I forced myself to act. "Suction," I snapped. "We're losing him." The nurse obeyed, and I steadied my hand with instruments, pressing gently against the heart's surface. The instant I touched it, a jolt ran through my arm like static electricity. I flinched, nearly dropping the clamp. "What the hell was that?" the anesthesiologist muttered. "Nothing," I lied. "Nerve conduction, artifact." But I knew it wasn't artifact. I knew what a twitch felt like. This was different. This was intentional. I examined the coronary vessels, expecting blockage. Nothing. I palpated the great arteries, looking for aneurysm. Normal. Every test, every check came back clean. The man's body had no reason to be dying, and yet his blood pressure was bottoming out. His pulse vanishing, his oxygen plummeting. "Epinephrine," I ordered. The nurse pushed it through the central line. The numbers jumped for a moment, then crashed harder. The heart's writhing grew worse, each spasm jerking against my hand as if trying to push me away. The scrub nurse whispered, "It doesn't want you to touch it." Her words cut through the sterile air like a scalpel of their own. I wanted to snap at her, to tell her there's no such thing as want in a heart muscle. But deep down, something in me agreed. I thought of his wife outside the glass, her lips forming the word, "Stop." I thought of his lips moving on the table, the silent warning. And here I was, ignoring all of it, cutting deeper, intruding into something that maybe was never meant to be opened. But I couldn't stop. A surgeon doesn't stop because something feels wrong. A surgeon pushes forward, finds the pathology, fixes it. That's what I told myself as I reached for the scalpel again. I extended the incision, exposing more of the chest, tracing down toward the diaphragm. The smell hit me then. Not blood, not infection, but something acrid, metallic, almost electrical, like scorched wires. It burned in the back of my throat, and I saw the anesthesiologist cover his nose with his sleeve. "What is that?" someone asked. No one answered. I peered down, following the line of tissue, and froze. Along the pericardium, the thin sac surrounding the heart, tiny fissures were appearing, as if the tissue itself were splitting from within. Not from my scalpel, not from trauma, but on its own. Thin cracks spreading like veins in marble, widening as we watched. The heart spasmed violently then, the monitor erupting into a flat line. Alarms wailed. The room bathed in a wash of red light from the overhead indicators. "Code blue," the anesthesiologist shouted. "Internal massage," I barked, and without hesitation I reached into the chest cavity, wrapping my hand around the heart itself. It convulsed against my palm, hotter than fire now, thrumming with a force that felt deliberate. I began compressions, squeezing in rhythm, willing it to remember how to beat. But as I pressed, I felt something shift beneath my grip. Not muscle, not fluid, something else. A movement that wasn't in sync with my hand, something deeper inside, something trying to push back. I froze, staring down at my glove encasing the organ, and for a heartbeat, no, for a moment longer than that, I felt it pulse against me like a second rhythm, one that wasn't mine, wasn't his. "Doctor!" the nurse screamed. "You're burning! Look!" I looked down and saw smoke rising faintly from where my glove touched the heart, a thin wisp curling toward the lights. The latex had bubbled, blistered, as though seared by contact. My hand trembled, but I didn't let go. I couldn't. If I did, I knew he was gone. The flatline shrieked in my ears. I pressed harder, harder, each squeeze sending another shudder through my arm, my chest, my skull. My vision blurred, my breath ragged until suddenly, the monitor beeped. Once, twice. A jagged rhythm stuttered back to life. "He's back!" the anesthesiologist shouted. Relief surged through the room like oxygen flooding into starving lungs. But I didn't feel relief. I felt dread. Because the heart in my hand wasn't beating in any rhythm I'd ever known. It was erratic, yes, but purposeful. Each contraction felt chosen, like it was answering to something, or someone. I pulled my hand back, staring at the angry red burn seared into the glove, the heat still throbbing in my palm. The monitor steadied, the numbers creeping upward. Against all reason, the man was alive again. The team exhaled, murmuring to each other, relief softening the edges of fear. But I didn't exhale. I just stood there, staring down at the heart, watching it twist and writhe in its cage, each movement sending ripples across the fissures of the pericardium. It wasn't supposed to be possible. None of it was. And yet, there it was, beating under my hands, keeping him alive in a way no medical book could explain. I should have felt triumphant. Instead, I felt like I'd opened a door that was never meant to be opened. And whatever was on the other side was now looking back. The relief in the room was fragile, thin as the hum of the monitors that marked his unstable return to life. Nurses exchanged glances, their movements looser, as if we had bought time. But I didn't loosen. My eyes never left the heart. It continued to writhe, not with the familiar cadence of systole and diastole, but with something unpredictable, alien. Every contraction was a shudder, every pause a moment of waiting, as if the organ itself were considering whether to continue. I forced myself to step back into my role. "Stabilize perfusion," I ordered. "Let's get a better look at these fissures." The scrub nurse adjusted suction, her hands shaking just enough for me to notice. I leaned in, examining the pericardium where the cracks had spread. The tissue had not torn in the jagged way of trauma, but split in symmetrical lines, neat, like fault lines, etched with purpose. I pressed gently with the tip of an instrument, expecting seepage of fluid. Nothing. The lines didn't ooze, didn't bleed. They simply sat there, pale against the shimmering membrane, as if waiting. Behind me, the anesthesiologist muttered, "Pressure's coming up. 80/50. But this isn't physiology. It's something else." I wanted to shut him up. I wanted to drown out every whisper that echoed what my own mind screamed. This wasn't medicine anymore. But instead, I did the only thing I knew how to do. I cut deeper. "Retract further," I said. The assistants obeyed, pulling open the cavity until the heart was laid bare in the halo of surgical lights. The fissures pulsed faintly, expanding and contracting not in rhythm with the heart, but against it, like two rhythms playing over one another. The sight turned my stomach. I'd trained my entire career to read anatomy as a language, to see logic in the architecture of tissue. This was not architecture. This was handwriting in a script I couldn't decipher. The monitor screamed again, heart rate spiking to 150, then collapsing to 30. Numbers rolling like dice, mocking us with each throw. I reached for a clamp, but the moment the steel brushed the surface of the heart, the rhythm steadied. Just like that. 120, consistent. I froze, staring at the spot where metal met muscle. It was responding. Not to medication, not to electricity, but to touch. "Doctor?" The circulating nurse's voice quivered. Are you seeing this?" "I'm seeing it," I said, my voice a whisper rasping against the mask. I wanted to believe it was some bizarre, vagal reflex, some quirk of conduction we didn't yet understand. But the precision was undeniable. When I pressed harder, the heart slowed. When I lifted, it quickened. It was following me. I remembered his lips again. The word stop. The heat that scorched my glove. The sense, more than the fact, that the body itself didn't want me here. And still, I couldn't stop. "Close the pericardium," I said suddenly, pulling my hands back. The nurse hesitated, startled. "But we haven't—" "Close it," I barked. "Now." We began suturing the membrane back together, sealing the fissures as best we could. With each stitch, the monitor wailed, heart rate faltering, pressure dipping. By the last stitch, the line flatlined again. The room exploded in noise, alarms, shouts. The crash cart rolling in. "We're losing him!" the anesthesiologist yelled. "Defib," I snapped. Paddles slapped into my hands. I pressed them to his chest. "Clear!" The jolt surged through his body, arching him off the table. The monitor twitched, then stayed flat. Again. Another jolt. Nothing. The wife's scream pierced the glass outside, muffled but unmistakable. "Charge higher," I ordered. The paddles buzzed in my grip. "Clear!" This time the jolt sent a ripple through the heart that was visible to the naked eye, a wave running across its surface like liquid fire. And then, impossibly, the fissures sealed. Before our eyes, the cracks in the pericardium drew together, knitting closed as though they had never been there at all. The monitor beeped once, twice, then steadied into a rhythm so perfect it was obscene. 72 beats per minute. Textbook normal. The entire room went silent. No one moved. No one spoke. Even the machines seemed quieter, their beeps subdued, reluctant. I stared, transfixed. The heart looked ordinary now, its earlier writhing gone, just a muscle pumping blood. And yet, the memory of its movements clung to me, crawling beneath my skin. Finally, I forced myself to speak. "Close him up!" The nurses obeyed, their motions mechanical, robotic. The air was thick with something heavier than antiseptic, fear. We sutured layer by layer, returning his chest to its unbroken form, hiding away the evidence of what we had seen. My hands moved with precision, but my mind was a storm. Outside, his wife pressed against the glass, eyes wide, lips trembling. She mouthed something again, but I couldn't read it this time. I didn't need to. I knew it was the same word. Stop. And still, I didn't. I tied the last stitch, stripped off my gloves, and stepped back from the table. My palms burned beneath the latex, raw and throbbing, as if the heat had sunk into my flesh. I flexed my fingers, trying to shake the sensation, but it clung like a brand. The anesthesiologist broke the silence first. "He's stable," he said, his voice thin. Stable. The word felt wrong. Nothing about this was stable. The patient lay on the table, chest rising and falling in perfect sync with the ventilator. The monitors hummed their steady reassurance, but I couldn't shake the image of that heart twisting in my hand, of fissures sealing themselves as if the body had made a choice, independent of us. I stripped off my gown and stepped out of the OR into the corridor. The wife was waiting, eyes locked on mine, searching for an answer. For a moment, I had no words. What could I tell her? That her husband was alive, but for reasons I couldn't explain? That I had seen something in his chest that didn't belong to any medical language I knew? He made it through surgery, I said finally, my voice steady though my hands still shook. He's alive. Her knees buckled, relief and grief crashing together in her expression. She pressed her hands to her mouth, tears spilling down her face. But I didn't feel relief, only dread, because in the depths of my soul, I knew we hadn't saved him. We had only witnessed something using him, and it wasn't done with us yet. We wheeled him out of the operating room just after 3 a.m, the hour when exhaustion weighs heaviest and the hospital halls echo too loudly with every footstep. The ICU was quiet, its dim light a strange contrast to the glaring white blaze of the OR. He was alive, stable on paper, monitors singing a lullaby of regular vitals, blood pressure holding, oxygen perfect, heart rate steady at 72. It should have been a victory, but no one on the team smiled. No one even spoke. We rolled him into his room, connecting the monitors and ventilator. The nurses moved mechanically, their silence thicker than the hiss of oxygen and the drip of IV pumps. I stood at the foot of the bed, staring at his chest rising and falling beneath the sterile drape. And for the first time in my career, I didn't trust what the machines were telling me. They said he was fine. My gut said otherwise. The charge nurse whispered, "Doctor, do you want me to chart everything we saw?" Her eyes flicked toward me, wide, pleading. "Chart vitals, meds, procedure," I said flatly. "Nothing else." She hesitated, but "Nothing else," I repeated sharper now. She nodded, retreating, as though relieved not to have to find words for what we had witnessed. I should have left then, handed him off to ICU, and collapsed in the call room, but I couldn't move. My legs felt rooted. I watched his chest, each mechanical rise and fall, and all I could think of was the heat of his heart in my hand. The fissures sealing shut, the impossible rhythm that had seemed to choose whether or not to beat. A soft knock at the glass pulled me back. His wife stood outside, still barefoot, her robe now clinging with damp sweat. Security should have taken her home hours ago, but she hadn't moved. I stepped into the hall, closing the ICU door behind me. "He's alive?" she asked, voice trembling. "Yes," I said. "He's stable, for now." She exhaled, a shudder that looked like it might break her. But then her eyes lifted to mine, sharp, too sharp for someone who had nearly lost her husband. "You saw it, didn't you?" she whispered. I froze. "Saw what?" Her lips trembled. She glanced toward the ICU door, then back to me. "He told me it would happen. He said something was inside him, waiting." A chill rippled through me, colder than the sterile air. "What do you mean?" Her voice cracked, but her words were steady. "He told me not to let anyone cut him open. He said if they did, it would wake up." I opened my mouth, then closed it again. How could she possibly know? How could he? She reached out suddenly, gripping my forearm with surprising strength. "Promise me," she said fiercely. "Promise me you won't take him back to surgery." Her nails dug into my skin through the sleeve of my scrubs. I pulled back gently, freeing myself. "We'll do what's necessary to keep him alive," I said carefully. "That's my job." Her eyes glistened, but there was no gratitude in them, only fear. Back inside the ICU, I found myself staring at his face, pale and motionless under the ventilator tube. For a moment, his eyelids twitched, rolling faintly. I leaned closer, and I swear, God help me, I swear I saw his lips move again. No sound, just the ghost of a word. The same one. Stop! I jerked back, pulse pounding in my ears. My rational mind screamed for explanation. Posturing reflex, random muscle twitch, neurological artifact. But deep inside, I knew better. It was communication, not from the man, from whatever I had touched inside his chest. By morning, word of the case had spread through the hospital. Not officially, nothing ever does, not when it defies reason, but in whispers passed along corridors, in sidelong glances exchanged in the cafeteria. The scrub nurse avoided my eyes. The anesthesiologist kept to himself, charting in silence. Even the residents, usually eager to dissect the strangest cases, said nothing. It was as though the OR had become a confessional, each of us sworn to secrecy, not by policy but by terror. I tried to ground myself in medicine. I ordered every test in the book: MRI, echocardiogram, full panel labs, toxicology, neuroscans. Each came back clean. Perfect even. His brain against all odds showed no damage. His heart looked textbook normal. His blood was pristine. The reports piled on my desk like accusations, each one insisting he was fine. And yet, every time I checked his room, I found the monitors holding steady, but the air felt wrong, heavy. The nurses felt it too. I could see it in the way they lingered by the door instead of entering, in the way they whispered when they thought I couldn't hear. On the second night, I stood in the doorway watching him. His wife sat vigil at his side, eyes hollow, hand clasping his. The ventilator hissed, the pumps ticked, the monitor beeped its steady rhythm. Normal, ordinary. Then, without warning, the monitor spiked. Heart rate 180, blood pressure crashing, alarms shrieking. I rushed in, shouting orders, the team scrambling. But his wife didn't move. She just kept holding his hand, staring at him as though she had been expecting this. "Crash cart!" I yelled. "Epi now!" We pushed meds, adjusted vents, prepared to shock him. But just as suddenly as it began, the numbers returned to normal. The alarm silenced. His vitals steadied as if nothing had happened. I looked up, sweat dripping down my temple, and saw his wife's eyes fixed on me. "He doesn't want you," she whispered. I opened my mouth to argue, to tell her she didn't understand, but the words died in my throat, because in that moment, I realized I believed her. Later, alone in my office, I stared at my burned hand. The blistered skin was tender, mottled red where the glove had melted. I should have reported it, should have logged an incident, but I didn't. I just wrapped it in gauze and told no one. The mark felt personal, as though it hadn't come from heat at all, but from contact with something alive, something aware. Sleep didn't come that night. Every time I closed my eyes, I saw the fissures knitting shut, felt the heart twitch against my palm, heard the silent word on his lips. Stop. But I hadn't. I'd cut, I'd touched, I'd woken whatever was inside him. And deep down, I knew it wasn't finished with me. By the third day, I had memorized the cadence of his room, the way a musician memorizes a piece he wishes he'd never learned. The ventilator's soft sigh kept time with the slow drip of the IV pump, and the monitors stitched their metronomic thread through hours that felt both endless and brittle. And yet, the moment I crossed his threshold, the rhythm bent, as if the room itself inhaled and held its breath. The staff had begun to avoid eye contact, which in a hospital is its own language. The charge nurse left his morning labs clipped to the door instead of handing them to me. The respiratory therapist adjusted settings and left without her usual nod. The anesthesiologist from the surgery took a different hallway when he heard my footsteps. No one asked what we had seen in the OR, and no one said they didn't believe it. Silence had become our consent, the test that should have grounded me, unmoored me further. The echo showed valvular motion, as elegant as a textbook diagram. The MRI painted a brain with no evidence of hypoxia. Metabolic panels returned the kind of numbers you want to frame and hang as proof that a body can behave. And yet when I stood at his bedside, the skin along my burned palm prickled, a warning that felt older than science. And the perfect waveforms on the screen faltered for half a beat, like an eye flinching at a sudden light. I tried to speak to him the way I speak to patients who cannot answer, low and steady, not for the family's sake, but for my own, to anchor myself inside the ritual of care. And the moment I said his name, the line tracing his pulse climbed 5 points and held, as if recognizing me. I told myself it was coincidence and kept talking. I asked him to let us help him, to keep breathing, to stay, and his lips shimmered with a movement so slight it could have been a draft, except there was no draft in that sealed, climate-controlled cube. The word that wasn't a word brushed past, the same shape I had seen in the ER and the OR, and I stepped back because I didn't trust my feet to hold. The wife arrived with a sweater thrown over her robe and a paper cup of coffee she never drank. She slipped into the chair beside him with the familiarity of someone who had been living in the ICU for years instead of days, and asked me, without preface, if I had ever ignored a warning and regretted it. The question found an old bruise. I remembered a young man with a hidden tear in his aorta who smiled through his pain and fooled me for an hour, long enough for his life to empty into the cavity of his chest. I remembered a girl whose belly ache masked a ruptured appendix because I believed her laughter more than her labs. I remembered every hallway I had walked, believing I could outpace consequence. I told her the truth, that regret is the shadow of our profession, that we learn to carry it the way we carry the weight of a lead apron in radiology. Heavy but necessary. She nodded as though she had been waiting for that answer and said her husband used to dream he was in a white room filled with hummingbirds that weren't birds, with a ceiling that never ended, and that in the dream he would hold his breath because breathing made the room notice him. I had no clinical box for that, so I set it gently on the shelf where I keep the stories that refuse to be translated, and promised her we would keep him safe. After she left to speak with a social worker, the alarms sounded without building. No prelude, no drift, just an eruption into chaos. Heart rate 180, blood pressure dropping, oxygen saturations melting away, the ventilator forcing breath into a body that suddenly didn't want it. The nurses flooded the room with practiced efficiency, and I snapped orders born from 1,000 such moments. Fluids wide, push phenylephrine, prepare for cardioversion. And the instant my gloved hand hovered over his sternum, the storm calmed, as if a hand had lifted from a throat. The numbers drifted back into range. The nurse closest to me made the sign of the cross so small she might have been brushing lint from her collar, and I pretended not to notice because I did not trust the part of me that wanted to join her. That evening, a resident brought me a stack of journal articles, as though paper could launder the memory of smoke curling off a heart. Rare conduction disorders that mimicked intelligence. Case reports of pericardial inflammation with atypical fibrillation patterns. A review of psychosomatic phenomena that could alter cardiac output through autonomic surge. We sat side by side under the office's fluorescent buzz, our faces the color of old milk, and highlighted paragraphs that might make us feel less alone. I wanted desperately to find one sentence that would say we had not opened a door we should have left. Closed. Instead, we found language that tried to name the inexplicable without admitting it. When the resident left, I called the hospital chaplain. I did not choose her because I had run out of medicine. I chose her because every good hospital knows the limits of its own doctrine She arrived before midnight, gray hair braided, eyes clear and attentive, a presence that refused melodrama. She did not ask for the narrative. She asked to stand in the doorway of his room and breathe. And she did for a long minute, as if she were tuning to a frequency I could not hear. Then she stepped to the bed, touched the rail, not him, and said in a voice meant for the air rather than the flesh upon it, "You are seen." The wife watched with a mixture of hope and dread, and I stood at the foot of the bed, feeling like an interloper in my own house. The monitor hummed along, indifferent. The chaplain did not pray the way some do. No bargain, no commandments. She just repeated, "You are seen," until the edges of the room softened, and my burned hand stopped throbbing for the first time since the OR. She asked permission to return at dawn, and I nodded because I did not trust myself to speak without breaking something fragile. At 2 a.m, the hospital flickered, the kind of power dip that scrubs the lights for a heartbeat and returns them, sheepish. When it happened, the monitors in his room blanked to black, not the usual reboot sequence, just silence and dark, and yet I could hear his heart. Not through stethoscope or speaker, but through the soles of my feet, a low animal drum against the tile that vibrated bone. The generator kicked in, the screens flared back with their grid lines, and the numbers reappeared as if nothing had happened, but the nurses had stilled into statues, and one of them whispered. It kept going in the dark, and no one answered, because the floor itself had given us the only answer we were capable of hearing. On the 4th day I tried the rational theater again, and asked for another echo, this time with me at the bedside. The tech gelled the probe and pressed it to the chest in that patient, precise way that makes anatomy bloom on screen. The image that swam into focus was perfect. Chambers contracting, valves billing and closing, blood moving like a river that has no memory of flood. Then the probe warmed against my fingers, hotter than machine norms, and the tech hissed and jerked back, the image shattering into static. We checked the device. The diagnostics insisted nothing was wrong. We tried again. The moment the probe kissed skin, the warmth rose, the image broke, the room tightened. We stopped, and the air loosened as if letting go of a breath it had held too long. Afterward, the tech sat in the hall with her hands pressed flat against her thighs and said very quietly that she would not go back into that room and that she was sorry. I said I understood, and I did. By then, my colleagues had started to offer the kinds of advices you give a man you think might be drowning. Take a day off. Hand the case to cardiology. Let the intensivist manage the hour-to-hour. Sleep. I told them I would, and then I did not, because I had begun to sense that the case did not belong to a department. It belonged to me, and that is the thought that begins to rot a surgeon from the inside. The wife brought their wedding photo, a frame too cheerful for an ICU nightstand, and set it beside his bed. He wore a suit a shade too tight in the shoulders, and she wore a dress that made light look like it had been poured over her. They were grinning at the camera in the reckless, ordinary way people grin when they believe life is a row that will obey them. I found myself studying his throat in the picture, the notch above his sternum, the way the skin folded when he laughed, and I wanted to apologize to the boy he had been for the cut I had made through the man he had become. In the afternoon, a neurologist stopped by to test reflexes, even though the scans said we were chasing ghosts. She tapped tendons and tracked pupils, and did the practical dance that tells a different story than the images do. When she brushed the pad of his foot, he flinched, small but real. When she called his name, his eyelids trembled. When she asked him to squeeze her fingers, nothing happened until I stepped closer, and then his hand closed, not around hers but in the air, just once, the way a man might reach for a ledge in the dark. The neurologist wrote her notes and thanked me and left, and I sat down hard because the room tilted and my body had run out of lies it could live with. That evening, While writing an addendum I knew would bury more than it revealed, the anesthesiologist from the OR knocked on my door and stood without sitting, hands in his pockets, eyes on the floor, and said he had started drinking coffee in the chapel, which was a stupid place to drink coffee because of the taste of candle smoke, but that it made his hands stop shaking. He asked if I had told anyone about the smoke curling off my glove, and I said no, and he said good, and we were quiet together for a long time, because sometimes the only fellowship possible is two people agreeing to keep faith with an experience that would be mocked if handled carelessly. When he left, I went back to the ICU, to the hum and the glass and the light that never really turns off. I stood at the foot of the bed and felt the weight in my chest I used to call vigilance, and now called something closer to dread. I told him the truth out loud for the first time, that I did not know what he wanted and I did not know what I had invited, and that I would not cut him again. The monitor did not cheer or recoil. It held steady, but I felt a loosening, as if a knot had admitted it was a knot. The wife came to stand beside me, her coffee still untouched, her sweater smelling faintly of rain, and said without looking at me that he had always been the kind of man who fixed radios by listening to the static, that he could hear where the wires wanted to be, and that when he slept he often twitched his lips as if he were answering a question no one had thought to ask. I wanted to tell her I finally understood what question I needed to ask, but could not bring myself to say it aloud, because asking would make an answer obligatory, and I had begun to fear answers more than I feared the unknown. In the half hour before dawn, the chaplain returned as promised. She stood at the rail and breathed and said, "You are seen once, twice, 3 times," and then turned to me and asked if I would be willing to step outside the doorway for a count of 50. It was a ridiculous request. I am a surgeon. The idea of leaving a patient because someone asked me to count like a child at recess should have offended me. I agreed. I stood in the hall and pressed my burned palm against the cool glass and counted under my breath until numbers felt like pebbles in my mouth. And when I reached 50, I stepped back in and found the ventilator cycling lower, the monitors unchanged, the air easier. The chaplain inclined her head, as if to say that acknowledging presence had altered nothing and everything. I thanked her sincerely, because gratitude had become one of the few clean instruments left to me. Then the room went still in that charged way rooms do before something tips. His eyelids fluttered, opened. He did not track. He did not focus. He breathed with the machine and gazed at a point above me that no human eye should find interesting. His lips formed the shape I knew and feared, but this time a whisper scraped the air around the tube, a sound so thin it could have been imagination if it hadn't carried the weight of command. Stop. My burned hand throbbed. The monitors held at 72. The wife gripped the bed rail so hard her knuckles blanched. And in that suspended instant between the warning and what it demanded of me, I understood why some doors stay closed, and why some surgeons break not from failure, but from the knowledge that success cannot always be told from trespass. I have been a surgeon long enough to know that medicine is not omnipotent, and that science is not a fortress but a lighthouse. Bright in the dark, yes, but ringed by a sea we cannot map. Most of the time, that light is enough to guide us, to keep us from drifting into despair. But sometimes we meet a case that doesn't belong to the charts or the journals, and in those moments the sea rises up, black and endless, and we realize how small the light really is. For weeks after that night, I carried on as though I were the same man. I made rounds. I scrubbed in. I taught the residents the anatomy of the abdomen with the calm assurance of experience. I laughed, even when laughter was expected of me. But inside something had shifted. It was not just the patient who haunted me. It was the knowledge that I had reached into the chest of another human being and touched something I could not name. Something that pushed back. He survived. That's what the chart says. That's what the wife clings to. He walked out of that ICU weeks later, his hand in hers, his steps unsteady, but his life intact. The nurses whispered that it was a miracle, and I suppose by their definition it was. But when I watched him leave, pale and thinner than before, his eyes never once met mine. It was as if some part of him knew what I had done, what I had seen, and wanted no part of it. At night I still wake to the phantom heat in my palm, the memory of his heart writhing, the fissures sealing shut beneath my fingers. I remember his lips forming that word again and again, the same word his wife repeated to me in the hallway, the word I ignored because my profession has trained me to believe that cutting is always the answer. I saved his life, that is the truth. But another truth, heavier and more enduring, is that I may have broken something far larger than one man. People ask me sometimes, young doctors, students, family at holidays, what the hardest part of surgery is. They expect me to say the hours, or the blood, or the deaths. I usually give them a polite answer about fatigue and sacrifice. But the truth? The hardest part is living with the questions that never resolve. The cases that leave you staring at your hands and wondering if healing and harm are not sometimes the same, act performed under different names. I am a surgeon. I am trained to fix, to repair, to act. But that night taught me that not everything broken is meant to be opened, and not every silence begs for intervention. Some things are warnings and the cost of ignoring them is not measured in charts or mortality rates, but in the quiet erosion of certainty. I cannot explain what I touched. I cannot tell you why his body defied everything we know, why his heart writhed like it was aware, or why the fissures closed themselves as if by will. I can only tell you that I saw it, I felt it, and I carry it with me still. When I look back on my career, I see triumphs and losses, saves and failures, patients who lived and patients who died. But this case, this one sits apart, like a shadow on the edge of every other memory. It did not just test my skill, it tested my faith in the very fabric of medicine, in the order of things, and it left me with a question that no textbook can answer. I have come to accept that the question will never leave me, that it will echo in my bones until I am the one lying on a table under fluorescent lights, my chest open to whatever waits within. The case will always haunt me, not because I failed, but because I succeeded, and in succeeding, I may have crossed a threshold I was never meant to step through. It will follow me into every operating room, into every quiet night when the halls are empty and the machines hum their endless chorus. The charts will never show it, the textbooks will never name it, but I will carry it, burned into my palm, echoing in my memory. The case will always be the one that broke me,